health in dogs and cats. I'm the founder and product developer at Clover, and I'll be giving this webinar this morning. But before I get started, I need to do a little webinar housekeeping. So first of all, if you have any questions as I go through the presentation, there's a box on your screen where you can type in the questions. And then at the end of the presentation, I'll go through and I'll answer I'll answer as many of the questions as we have time. If your question does not get answered, I'll go back to that and I'll email, if you like, if you want a private answer, note that. Otherwise, I'll email the entire group and we'll give the answer to everybody. Also, if you think of something after the webinar that you didn't ask during the webinar, don't worry about that. There'll be a contact email at the very end and you'll have a chance to ask questions. So as we go through, since I won't stop for questions during the webinar, just in the interest of keep staying on time, just go ahead and type them in, and I'll see them as you type them in and I'll answer them. The second thing I'll let you know is that as we go through this webinar, and this is an in-depth look at joint health, there'll be a couple of times where we'll stop and you'll have the opportunity on your computer to answer some questions, and I'll be able to see that as well. And that's just to make sure that we're covering the information correctly and getting the information across. And so we'll go through a couple of times and ask you the questions. So this will be interactive in that way. Okay, so to get started this morning, again, I'm Rebecca Rose, the founder of Clover. The picture with me, this is Floyd. Floyd is a rescue golden retriever, and he is an office dog, so he's here with me this morning. So if you do hear dog barking, I apologize. We have now over 20 years experience in human and animal drug supplement development and commercialization. I've been working on this both on the human women's healthcare side and on the animal healthcare side now for, like I say, over 20 years, and am the author of 3 patents that are specifically on the composition and method for treating joint disorder in vertebrates and address the connectin product. And that's what we're going to be talking about right now, is the work that I've done in the area of joint health. And also we'll talk about, in general, and we'll talk about connectin specifically, but we're going to talk a lot about the different parts of the joint health market that maybe you don't have all of the information on. You know it's a pretty good market, but you're not sure exactly why or what the projections look like. And we'll go through all of that during the presentation. Clover was the first company to do force plate testing for arthritic dogs. And what that means is that with our connectin product, we did clinical studies using research veterinarian in their facilities, university facilities, where they had a large scale on the floor. And the dogs walked across this large scale, and at every pressure point, every time they stepped, we were able to take the amount of weight that they put on that joint. And then we were able to put them into the study where they would get either connectin or a placebo, and then we had them walk across the pressure plate several more times and measured how much weight they were able to put on that joint, which we had already diagnosed with as arthritic through x-ray analysis, how much weight they were able to put on that joint with taking the connectin and without taking the connectin. And so what we found was that there was a significant difference in whether they were taking the connectin or not when we unblinded the study and showed which product they were on. And if they were on connectin, on average 89% of the animals saw significant relief of symptoms in on average 15 days. So I'm going to explain to you, that was the start of our research, but I'm going to explain to you the reason why we saw such good results and such fast results and why that's important to you. But first, let me just go over a little bit about the market. So the U.S. supplement market overall, joint health is the #1 chronic condition that is helped with supplementation. And the supplement market overall is a huge market, but I think what's most exciting about the market that we're all in is that it's expected to increase by 39%. And we've seen double-digit growth every year. But 39% is a huge growth by 2012, and that will make the total market 1.7 billion. So it's a huge market. It's something that people are asking for, and they're doing a lot of research on their own right now. And we all know that while the internet has some remarkable attributes, it also can be a dangerous place if people are just getting a little bit of information and don't have the whole story. So that's why we enjoy doing these webinars, so we can give you more in-depth information, and then you can answer those questions when people get just a little bit of information off the internet. We're definitely seeing the supplement market grow due to a couple of reasons. One is that our animals are living longer, which is fabulous. So the average age now of dogs and cats have increased over what it was just 5 years ago. The second part of this, which is not so fabulous, is that we also have a lot of overweight animals that need additional medical care. And so the overweight issues cause tremendous problems, specifically with joint health, because every bit of extra weight on the joint creates an order of magnitude more problems with that joint capsule. Also, what we're seeing, which is a part of our good news, is that there's increased use and increased education with the vet community and clinically proven supplements. So the vets are recognizing that this is something people are going on the internet and they're getting some information, and it's hard to cull through all the different things that are out there. So let's focus on clinically proven products, and let's focus on things that have been shown to work and shown to work safely. Things like Connectin that have actually gone through that extra level of clinical studies. So we know that sales of small animal products account for a large number of sales in all the different pet markets. So we know through the work that Packaged Facts has done that this is a huge market, and it's only getting bigger. We're going to talk specifically about joint pain. It is the #1 chronic condition, with about 20 million dogs and 17 million cats in the United States who will develop joint disorder. So that's a huge number. So 37 million animals in the United States will be in need of some sort of joint support. And we're seeing that number continuing to increase. We'll go through a few reasons of why that number is increasing, but I think what that tells you is there are a lot of animals out there that are not currently getting help because the people don't know the right questions to ask, and sometimes they don't even know to ask the question. So sometimes we have to be more proactive. And I know for myself, I'll go out on the open space trail, and it's everything that I can do to not stop every person who's jogging with their dog, and their dog is bunny hopping. Their dog is obviously having swinging in the hips that shows dysplasia issues. So, you know, getting out there and talking to people sometimes is the way to build awareness. In addition to doing a broad overview of joint health, I'm going to talk specifically about the types of joint disorders. So I just mentioned hip dysplasia, and so hip dysplasia, which is different than arthritis, still something that is helped with the Connectin product. And we'll talk about some of the preventive options, and then we'll talk a little bit about the clinical studies that have been done with Connectin. First, we're going to go into we're going to peel back the layers and go into the joint capsule. So we know that there are a couple important points in the joint capsule. And one, if you see from the drawing, is the synovial fluid. So synovial fluid, which is the bluish color fluid on this diagram in between the two bones, and the cartilage is lining the bone. So that synovial fluid is what bathes the joint and keeps it so that it's moving freely, it's lubricated. And the major makeup, the major ingredient of the synovial fluid is something called hyaluronic acid. And that's known as the WD-40 for the joint. So that's an important component. And the dog and cat, the animal, naturally makes hyaluronic acid and replenishes that supply in the synovial fluid if it's a healthy animal. And we'll talk about some of the reasons why it might not be making enough, but if it's not making enough of the hyaluronic acid, then the synovial fluid will dry out. It will stop the lubrication of the joint, and then you don't have that nice smooth WD-40 constantly oiling your joint. The other point that we're going to dwell on a bit is the cartilage. So you see in this drawing, the cartilage is what lines the bone. So without cartilage, you have bone on, and without the lubrication of the synovial fluid, you start to get bone on bone. And that, of course, is a very painful situation. The two major ingredients of the cartilage are glucosamine and chondroitin. And so those are the ingredients that in a healthy animal, they're taking the nutrients that they are getting in their food, and they're putting them into the cartilage in their bones through the getting absorbed into their system, into the cartilage, and into the synovial fluid. So this would be an ideal healthy situation. Of course, if the body doesn't have enough of the building blocks of the glucosamine, the chondroitin, and the hyaluronic, then the cartilage and the synovial fluid are depleted, and the result will be weak, stiff, and uncomfortable pets and weak joints. And what's happening is that the cartilage is actually breaking down, and the water content is increasing, it's cracking, it can't repair those cracks, it can't become nice and fluid anymore, and in that case, crevices develop in the cartilage, and that goes all the way down to the bone. So you'll see on here that we also have, on this diagram, that we also have the muscles around the joint capsule. You'll have a much healthier animal if they get not only the supplementation, those joint building blocks, the glucosamine, the chondroitin, and the hyaluronic acid, all three of them are important, but also if those muscles are well developed and they're able to have a strong joint. That will help as well. This has a lot of information on it, this slide, but it basically what I want you to focus on are the three pink sticky notes that I've attached to this. And this just shows you there are three types of joints. There's the ball and socket joint, which is up by the hip. So that operates exactly like it sounds, like a ball and socket. The knee joint is like the hinge of a door, where the knee is moving in a perfect situation with that a degree of flexibility, like a hinge. And then the ankle area is the gliding joint, and that has a slightly different movement, but all three in a healthy dog will be moving smoothly. With a cat, it's slightly different. It has a lot of the same attributes, the same types of joints, but also cats have another another degree of movement in that they have an ability to rotate their wrist, and they're able to use that in grabbing and swatting prey, or as I'm owned by two cats, and it helps them to grab their family members as well when we're least suspecting. And that's a genetic modification that helps cats to hunt. And so they can, as I was looking at for this picture on this slide, I found a picture of a lion taking down a wildebeest. And you could see the powerful claws, the way their arms can rotate a little bit further out, the way they have an extra knuckle in their paw, so that they're able to grab and tear. And the quote on the picture that I was looking at was, if they had wings, they would be really dangerous. So cats have incredible skeletal physiology in order to catch prey, but for our domestic animals, it means they have just one more reason that they develop joint disorder. They have that extra knuckle joint, and then they have more range of motion to tweak. So the different types of joint disorder include the main category, which is arthritis, which is overall stiffness, and a lot of the different categories that are listed below will lead to arthritis if left unchecked. And so hip dysplasia, this X-ray actually shows an example of hip dysplasia, and it's in a cat. So I don't know if you can see it on here. It's where the ball and socket joint don't fit smoothly into the ball and socket. And this will often lead to arthritis. Patelloluxation is where the kneecaps are extended, and that happens a lot in our smaller dogs and in cats. It's very common. And then if you can remember back to the joint picture that I had on the previous slides, the ligaments that hold all of the joint capsule together, they can tear. And depending on where it is, the anterior craniocrucial ligament will tear, and that also can lead to arthritis. So all of these are names for different types of joint disorder that when we were doing our clinical studies, we found that Connectin helped with. So it wasn't just the, I think my dog has arthritis, or I think my cat has a dislocated kneecap. It covers all of the overall categories of joint disorder. And one of the best cases that we've seen, best being the results that were long-lasting and very profound, were one of our employees' dogs. When she first started with us, she had noticed that he had a swing to in his hips, and he's a very, very large Labrador Retriever. He looked like a bull mastiff. And so she took him to the vet, and he said that genetically he was just a train wreck. He had no ball and socket at all. His joints were just in horrible shape. He estimated at that point, and Gus was 4 years old then, he estimated that he would have about 6 months to live and would have severe, severe arthritis in his life. And so it would probably be the most humane thing to put him down. So she immediately put him on Connectin, and he went back throughout his life and had x-rays done on a routine basis. Of course, he always had the hip dysplasia. However, he never developed arthritis in his lifetime. And what what ended up happening, the vet was amazed that he didn't develop the symptoms of arthritis. He was very comfortable. He was able to run and to jump. He went hiking regularly. They waited the 6 months. They did not put him down. He died recently at 14 and a half. So that was a case where we couldn't fix the problem, but we could certainly make it better. And so some of the unusual things about Connectin and the reason that it works is that we decided when we looked at doing, when I developed Connectin, I put together a combination product that I felt was pretty robust and that it should work. But the only way I knew to prove that it would work was to actually go through the good laboratory practice studies, to do a placebo-controlled study, and to use the state-of-the-art quantitative analysis of the pressure plate. That's the big scale I told you about. So with Connectin, it was the first product to have actually gone through those pressure plate analysis, the first joint supplement to go through that. And now I think there's one other that has gone through the quantitative test. But it's very, very unusual in this category to have this level of foundational testing. And what we found in our clinical studies, which is the so what for you, is that Connectin works very quickly. Because the product is a combination product where it combines those all-important, all three joint building blocks, the hyaluronic, the chondroitin, and the glucosamine, with a combination of herbal ingredients, we were able to see significant results in 15 days. So if you look at a container of Connectin, you'll notice it's the only supplement that's allowed on the market to have this splash on it that says vet tested, proven, better mobility in 15 days. So we didn't see any side effects or any adverse effects with our clinical studies. We did see some happy side effects that we weren't really looking for, but this graph displays that when we did the initial test, the first thing we did is we put the dogs through x-rays, and so that we wanted to make sure that they truly had a joint disorder before, so that we weren't putting them through a trial when they had something else that needed to be looked at. And these were pets whose humans had tried everything else, and this was a voluntary study that they got free product, and so they just opted in. So we did the x-rays. We identified which joint had arthritis or had a joint arthritic symptom. And then we noted that. Then we put them through the paces of the pressure plate study. And what we found was not only did they see significant improvement in the joint that was identified as having joint problems, but they also saw significant improvement in the joint next to it. So that's what we're calling the contralateral limb. And what that tells us is that, and it makes sense if you think about it, when we have a sore hip, we tend to lean on the other leg, the healthy leg, and we start to wear that down as well. Not to the point in the study where we could see that in the x-rays, in the technology that we have, but to the point that we could actually measure an improvement in symptoms. So that's important as well, because that indicates that Connectin also has attributes as a preventive. And we hear that a lot with folks that have had an older dog that has had problems, has been helped with Connectin, now they have a younger dog, and they want to get them started right away. So the key is with Connectin, the reason that it worked so well in both our clinical study and has worked so well in the marketplace is that we did formulate this to be complete. So people will ask, so I'm giving Connectin, do I also need to give? And then they'll list some other products that they've heard about or they've tried, or maybe they're using for themselves and they want to know if they should give it to their dog. What we've done is we've taken all that guesswork out of it, where we've formulated this and we've done the clinical studies on the product that has all three of the joint building blocks in it, so that it will be most effective to the highest number of dogs and cats. And then in addition to that, what we've done is we've added 9 different herbal components, and this just breaks down for you what the categories that the herbal components are added for. And on this graphic, you can see that the herbs help the natural building blocks actually get into that joint capsule. And the way they do that, they help the delivery of those natural building blocks is through 3 main categories. One is as an anti-inflammatory, and my favorite anti-inflammatory is yucca. And yucca has the active ingredients, saponins, that are powerful anti-inflammatory agents, and they were used by Native Americans, were known as a natural steroid. So without the side effects, that's a powerful, powerful herb to use. And then we also have several other herbs, and you can see that there's some redundancy here in each category. So in the antioxidant category, I've just noted that the active ingredient in turmeric that helps as an antioxidant is its phenolic capability. And I simply point that out, and with the cayenne, the capsaicin, just so that you realize that even though the herbs are natural, and you just have to be a little bit cautious because herbs are really, really powerful medicinals. And all of the herbs in Connectin have not only been tested as safe and effective, but also they're all categorized as GRAS, G-R-A-S, which means generally recognized as safe. So there have been a lot of testing that has gone into these herbal components to ensure that they'll do what we say they'll do, and they'll do it safely and gently. So that's really important. So when somebody comes to me and says, well, I want to start connecting, but I'm my cat's on Boswellia. Should I continue on Boswellia? It's really not necessary because we formulated it so that it is complete. Another question that we get is, why don't you have MSM in your connectin formula? Well, MSM is an anti-inflammatory. It's a mineral. It's found in the earth. And we felt that the combination of herbs that we selected had a much more powerful yet gentle approach to inflammation than the MSM. So it's not necessary to add that. Okay, so now with this, we're going to go to our, I talked to you about asking a question. So here's a question on your screen. I'll give you a minute to complete it, and then we'll go through the answer. Okay, so you had a chance to go through the poll, and let me just point out that the correct answer, the 3 joint building blocks in connectin, glucosamine, chondroitin sulfate, and the hyaluronic acid. Oftentimes you'll see products that have glucosamine and they have chondroitin, but they are lacking the hyaluronic acid. Okay. All right, so very good. We're going to switch gears a little bit now, and we're going to go through the some of the how to identify whether an animal may have a problem with joint disorder. So the picture here of this Labrador Retriever kind of gives you a nice pictorial of all of the high-risk groups. So Whiskey is a purebred chocolate lab, so she is a purebred dog. She's a large breed. She's a Labrador Retriever, and she weighs about 75, 80 pounds. She is elderly. I don't know if you can tell from this, but if you look around her snout and at her eyebrows, she's white, and she is an athlete. She's just been swimming, and she's quite an uber retriever. So she has been on a maintenance amount, a preventative amount of connectin, primarily because of her being in all 4 of these high-risk groups, but also because she is a hunting dog. So she's very active, and she's a working dog. So she needs to have good joints, healthy system. With cats, it's a little bit more difficult sometimes to know whether a cat is in a high-risk group. However, what we've found in the last few years is that we're seeing more of the breeds of cats that are predisposed for joint problems. And so here I've listed, and I have pictures of the 3 breeds that are more predisposed, and primarily for arthritis and knee dislocation. And what we're finding is that our cats, number 1, are living longer, which is fabulous, and number 2, these 3 breeds have gotten into the general breed pool of cats now. So where in the past we didn't see, as with dogs, where we had certain breeds where you just pretty much knew that, okay, if you have a purebred dog that is of these breeds, they're probably going to have problems with joint disorder down the road because they're so genetically predisposed. With cats, we had a little more of a melting pot of breeds, and we didn't have so many of the breeds specifically that were bringing in markers for joint disorder. But now we're seeing a lot more of that in our general population. Also, we have a lot of risk factors with our pets living longer, more overweight pets. There was an article in the Wall Street Journal recently that said that the veterinarians were looking at pets and had actually assessed that of this group of pets, 47% of them, and it was a combination of cats and dogs, 47% of them were obese. When they asked the human if they thought their pet was obese, 11% of the humans thought that those pets were obese. So we have a little bit of denial going on as well. Factors also with poor diet, genetic predisposition, poor musculature. We talked about that. You need a nice strong muscle. That will help. It'll get you a long way if your pet is well muscled, gets good exercise, to keeping that joint healthy, even if they have some of the other risk factors. And then, of course, injury, which there's nothing you can do about that. You know, if you have an active athletic pet, sometimes injury will happen. So what should you look for? One thing that we hear over and over again is the inability to jump up on furniture. And that's something you just need to watch for. If all of a sudden you've always had a dog or a cat that jumped up on the chair or the bed and they can't do it anymore, ask yourself why. Now you see here, this is Floyd. I was working at home the other day, and I felt something staring at the back of my neck, and he had jumped up on the chair, which you can guess maybe, since Floyd doesn't even know how to sit in a chair, that he is not allowed on the furniture. So I don't know what he was thinking there, but I'm happy he's able to do it. Anyway, he has the ability. Also, not being able to finish a walk is a really big clue with dogs. If they love going on their walk but they can't finish it, or they just can't jump up in the car, if you're going to take them out for a hike, then that's a good indicator. Stumbling or bunny hopping, also other good indicators for dogs. And for dogs, it's a little bit easier. But if you go to cats, cats are more of a challenge because oftentimes you don't see their behavior changing. They sleep a lot, they're laying around a lot, but do notice if they've stopped grooming. And that you would be able to see typically with matted fur in the back end, because they're no longer able to twist to reach that to groom. Also, their toenails will get longer. The joints around their toes will get swollen, and sometimes they'll even be painful. So when you pick them up, they'll cry out. And remember, with cats, they have that extra joint, and oftentimes that's where they get problems with arthritis. Something that I hear more than anything else, though, is that my cat stopped using the litter box. I see no other symptoms at all, that there are no other illness issues surrounding it. It's just they don't want to hop in and out of the litter box. And so oftentimes that will be a clue that they have some pain and discomfort. So there are some ways to prevent and to reverse joint pain. And the number one way is good food is going to put good nutrients into the body. The second is weight loss, and I can't emphasize that one enough. And then supplementing the body with all three of the joint lubricants. Be careful that you have a complete product, and then ensuring the delivery of those joint building blocks. So I know that there are products that will take 6 to 8 weeks to work, and the reason is because although they do have the joint lubricants, they don't have any delivery method. They don't have the herbal component that's in connectin associated with it, and so it's not able to effectively and efficiently deliver those joint building blocks. It just takes a lot longer. Instead of the 15 days with connectin, it takes 2 to 3 months. So those are the keys. Now, something that we're seeing a lot now is a lack of exercise. And this is from a study that was done by the Veterinarians Association for the Prevention of Pet Obesity, that 45% of dogs are overweight and 58% of cats. When you think about the numbers, that is huge, because we know that right now in the United States there are 78 million dogs and 86 million cats. And so you can imagine that the picture of this dog prior to losing the weight, you can try all the medical miracles, and you're not going to get away from arthritis and joint pain. There's just too much weight. So sometimes you've got to back up and address some of the causes first. So with that, I'm going to turn this over to another poll, and this will be the very last poll. So I'll give you a minute to answer the questions on your screen. Okay, I thought this one would be a really tricky one, but obviously I was wrong. Everyone got this correct. So, so you know the reason why the herbal components are so important as well. It's really important that we get rid of the symptoms of the joint disorder as well, with anti-inflammatory, antioxidants, and circulatory stimulants. Okay, so we'll go back to, and we're down to just the last couple of slides, and then I'll open up for questions if anyone has questions. Okay, so the takeaway is that start supplementation early. This is something that affects such a wide number of dogs and cats. We do have veterinarians recommending that Connectin can be used as a lifelong preventive in animals who are predisposed to joint problems. So Floyd, who now has donned his lab coat and safety glasses to show you the entire line of Clover products, he is on Connectin, and it'll be a lifelong preventive for him. He's a rescue. He's about 5 years old. We don't know what happened. We have no backstory on the early part of his life before he came to live with us, but we do know that he is a golden retriever. He appears to be a purebred golden retriever. It's hard to tell since he's wearing a lab jacket, but he is a bit delicate in that he's he's just prone to different problems. So he does have some issues, and he loves to run, and so he is and will be on Connectin for life. Okay, I just want to share with you this we just got this week. So I just put up, this is the picture of the dog in the picture, Noku, is a rescue, search and rescue dog. So he's been trained to do search and rescue work. Shortly after receiving the training, found out that he had patellar luxation, so he had to go through knee surgery. So his owner, his human, had used Connectin before with an older dog, and so she started to give Noku the Connectin right after the surgery, and they've had amazing results with it. So it's quickly allowing his joints to heal, allowing his body to get back into some of the athletic endeavors that he loves to do. He's not yet gone back to search and recovery, but he is starting to go out on a leash now, and he's running, and he's had an amazing recovery, and in part with to connectin, and you can now you understand what the connectin is doing in that joint capsule to allow it to work and to allow it to work quickly. So with that, I'm going to turn it over to questions, and I'll also, while we're getting the questions together, I'll also just remind you that on your screen it has Terry Furman, our Director of Sales and Marketing. It has Terry's email address. It has our In Clover toll-free number, so that if you do have any questions, if you think of something later, please feel free to drop us a line, and we'll address those questions. And also, you're going to be receiving a survey at the end of this. The system will automatically send you a survey, and if you could just it'll take less than 2 minutes to fill it out. If you could please do that, that helps us to improve upon the webinars, make sure we're getting the right information out to you. Also, I'll give a little pitch for next Friday at the exact same time, 9 o'clock Mountain Daylight Time. We're going to be doing another webinar, and it will be a more in-depth webinar on digestive and immune health. So if you can join us then, that would be fabulous. So okay, let me get to some of the questions that you've had. The first question is a really good one that I did not address during the presentation, and I should have, is it okay to take connectin with Rimadyl? And Rimadyl is a non-steroidal anti-inflammatory drug. The generic is Carprofen, and sometimes they have trade names such as Rimadyl, Etergesic, Deramax. And what the non-steroidal anti-inflammatory drugs will do is they will address the inflammation in the joint with an arthritic joint, and they'll also help to mask the pain, because oftentimes by the time the animal is exhibiting symptoms of joint disorder, because there aren't nerve endings in that joint capsule, so by the time they're exhibiting symptoms, it's pretty far along. They're seeing some pretty painful results. So the non-steroidal anti-inflammatories help to immediately address that. And so oftentimes what will happen when you have a case of joint disorder, a vet will prescribe a non-steroidal anti-inflammatory drug and will also give connectin with that. Because while the non-steroidal anti-inflammatory is addressing the pain and the inflammation, it's really masking the ultimate problem. And what the connectin is doing is a totally different method of treatment, and what it is doing is providing those joint building blocks, the lubricants, the WD-40 for the joint, that the body would, in a healthy state, be providing itself. And then it's also giving the herbs to help address some of the symptoms as well. So yes, it is fine. Okay, so let me see. What are the possible side effects of using connectin as a preventive for the entire life of your pet? We have not demonstrated any side effects at all. And I wouldn't expect there would be side effects, because these are the building blocks that are naturally found in the healthy joint. So we're adding back what the body would if it were healthy, which is really our overall mission as a company. And the herbal components that we're adding, as I said, are generally recognized as safe, and then we've gone through all of the safety studies as well. Now, the safety studies that were done with connectin were done in 1996. So in addition to having the safety studies, we have a long history, certainly a lifetime history for a dog, of the effects of the product. And we have also, important to note, is that we have we keep track of adverse event reporting. So I didn't touch on the National Animal Supplement Council is a group, a nonprofit group that monitors this industry, the supplement industry. If you see that NASC seal, it's a yellow seal that's on the front of all of our labels. It indicates that the company has been audited by an external auditor. It also indicates that they participate in adverse event reporting. And so what that tells you is that anytime there's any kind of adverse event, that it will get reported back into a web-based database, and the Food and Drug Administration has access to that. In all of these years, for any of our products, we've never ever had a serious adverse event. Most of the adverse events, we record everything. So most of the adverse events are because our product, it tastes good. We have flavor in it to make it easier to give. And so most of them are that a dog, usually a Labrador Retriever, has knocked over an entire container of Connectin and has eaten this whole thing. And that will simply result in some transitory diarrhea because of the fiber content of the herbs, but there'll be no long-lasting effects. So it is very safe to give over time. Are there risks of giving larger doses than what is recommended on the bottle to animals starting on Connectin who are in desperate need of joint health? We oftentimes have veterinarians that will recommend that you increase the amount. We recommend to start that you double the amount and then you go to a maintenance. And the amounts were actually carefully, thoughtfully calculated in our clinical study. And we were looking at animals that had tried everything, and then their humans put them into this study. So we found that for most of the animals, doubling it to begin and then going down to half the recommended amount was the right formula. But for some animals who are in desperate dire straits, you can certainly increase that amount and there won't be any adverse effects that you'll find. You probably won't need it with Connectin as much as you might need it with other products that haven't been so carefully and thoughtfully dosed. Okay, so this, let me see. I'm going through the questions and just seeing in case we run out of time. But it looks like we still have 10 minutes. Let me go keep answering. I was told that glucosamine and chondroitin together make up hyaluronic acid. If this is true, then why not use hyaluronic acid only? So if you can think back to one of the early slides, all three are very distinctly different ingredients. So glucosamine plus chondroitin does not equal hyaluronic acid. So hyaluronic acid is something that is the primary ingredient in synovial fluid, and the secondary ingredient is blood. So that's what's carrying your nutrients back and forth through to your joint. So the hyaluronic acid is the WD-40, the lubricant for the joint. The glucosamine is the joint building block. So that's what's making up the structure of the cartilage that protects the bone. And the chondroitin sulfate is kind of like a rubber band. It gives the joint the elasticity. So they have three very distinct and different attributes that are very important to have all three of them. If you don't have one of the three, then you can see where, okay, if you're missing the rubber band, the elasticity, that's taking away from the effectiveness of the product. These are great questions, by the way. These are fabulous. Okay, the next question is it okay to take Connectin and Optigest together? So Optigest is our digestive supplement, and Optigest is a combination of the natural digestive enzymes that the dog or cat would be making normally if it were in a healthy state, and then also the prebiotic FOS. And the prebiotic is the food for the good native bacteria in their intestine. So, and that's all that's in that product. So yes, it's fine to give both of them together, and it's one of these things that if you do nothing else, that will cover, if you give both of those products, the Optigest and the Connectin, that will cover a huge percentage of the health issues that are commonly found with dogs and cats. Okay. The next question is, will my cat eat Connectin? Maybe. So with cats, it's always hard to tell. What we've done is we've made it extremely palatable, so it is a liver flavor. But even with that, we know that 50% of the cats will take it willingly. And the remainder, what we've done is we've made it, it's a soft tab, and it's scored. And so you can just easily crush it with your index finger and your thumb. You can just crush it and mix it in with broth or food. And then we have great compliance. But sometimes you do have to take that extra step. And with my cats, and they were the ones that you saw sprawled out in one of the slides, sometimes they'll take it and sometimes they won't. It just really depends. Sometimes they'll just take it readily, and other times I have to crush it and mix it in with their wet food to mask the odor. So it really depends on the cat and the day of the week. Do you recommend the tablets or the powder format? Which sells better? The powder and tablet, it's 50-50 as far as our sales numbers. Some people like putting a powder over the food. Other people prefer just to give a chew tab. Both have pretty high compliance, although the tablet has a slightly higher compliance. So if you have a real picky dog, I would recommend going with the tablet instead of the powder. It's all the same ingredients, but it's a slightly different formulation because we developed the powder first, and then when we went to develop the tablet, we found that we had to, if we just took the powder and tried to smush it into a tablet, it would be a wafer the size of my cat's head. And so what we had to do is to use some herbal extracts, tweak a little bit so that we could get the tablets into a more manageable size and number to give. But then what we did, because we did have to tweak the formulation, is we went back and we repeated all of our clinical studies. So if somebody asks which format works the best, they've both been proven clinically. And so you can recommend whichever one is easiest for them to give. Okay. The next question is, at what age should Connectin be started? In our clinical studies, we had animals from age 6 months to 19 years. So pretty broad range, and so it's safe to start it at a young age. I got Floyd when he was we guessed about 1 year old, and started him on it immediately because I had no backstory and he's a high-risk group. So it's safe to use as low as 6 months is the answer to that. Okay. All right. I think I'm just going back through the list to make sure I've answered all of the questions that I have on here. So I think that was the last question, and so with that, I will go ahead and end the webinar. Certainly, if you have other questions, feel free to give a shout out. This webinar is also being recorded, and so we will follow up with a link for you in case there are other folks that weren't able to join us live this morning that want to join for the recorded version. So thank you so much for your attention.